Hi, so good to see you again. Today we are talking about a very important topic that I know is near and dear to most of our hearts as women. I am Dr. Andrea Purcell, and you are watching straight from the doctor's desk, where we help women find the right combination of tools they need to get back to the health and the life that they love using natural medicine. Today's topic is about different approaches to weight loss and a discussion on the newest class of drugs taking the weight loss industry by storm, those semaglutides. So yes, stay buckled into your seat here for today's topic. That shedding of unwanted weight can be difficult to do, especially in menopause. You combine those hormone shifts with a sedentary job, poor eating habits, and we have a recipe for weight gain. So when it comes to weight and how it relates to women's health, it is a complicated topic. There are many reasons why a woman's weight can become stuck. Lack of good nutritional information for what she needs in her body, having the dieting mindset that our culture is so fond of, hormonal imbalances, stress, overwhelm, illness, portions, timing of meals, and an inflamed liver, just to name a few. Shedding extra pounds helps women reduce their risk of cancer recurrence, diabetes, cardiovascular disease, and arthritis, just to name a few. So absolutely, weight loss is important. And in today's discussion, we're going to be talking about the different approaches to weight loss and the latest little darling on the market, the Ozempics, also known as the semaglutides, and all the variations of it. Culturally, I believe that our dieting mindset is the single most undermining concept when it comes to weight loss today. We are led to try good health for a short period of time instead of trading in good health for the long term. And the whole dieting industry just really sets us up to fail. Trying is like eating one piece of broccoli and expecting to lose 5 pounds, right? There have been a lot of diets that have passed through since I graduated from medical school. And I'm going to see if I can remember, not all of them, but a whole bunch of them. I think starting with the cabbage soup diet, and then we went to fasting, the keto diet, HCG, Atkins, Metafast, Weight Watchers, and then we have those packaged food diets, Nutrisystem and Jenny Craig. There was South Beach, Mediterranean, Whole30, the Zone, the blood type diet, and then of course the diet drugs, right? Remember fen caused heart problems in women, then there's phentermine, and our latest little darling, Ozempic, semaglutide, and those variations. So in our culture, we're led to believe that we can lose weight with a quick fix. They dangle the carrot in front of us. And quick fixes are nice sometimes. It's just that they don't last. And in the case of weight loss, they aren't individualized. And they don't get to teach you much about how to properly feed your body with the body that God gave you once you get to your goal. So unfortunately, many women end up gaining their weight back. And this leads to a yo-yo dieting situation. So let's just talk about the semaglutides, right? So this is the latest quick fix out there. Right now, there are several semaglutides approved by the U.S. Food and Drug Administration for either diabetes, chronic weight management, and they're developing more with more on the way. Semaglutide is a synthetic medication that mimics human hormone called GLP-1, and that's short for glucagon-like peptide 1. And as a glucagon-like peptide 1 receptor agonist. So it triggers the release of GLP-1 into your GI tract, which happens normally when we eat. And the GLP-1 causes insulin to be produced by the pancreas, which opens the door to our cells and lets the blood sugar in and reduces blood sugar in the blood. And then it lets us know when we're full. So the semaglutide fakes the body into thinking that it's already full while it slows down digestion. And that's how people lose weight on it. So what are the risks? Well, every drug comes with risks, right? We have some GI side effects: nausea, diarrhea, abdominal pain, vomiting, and constipation. Maybe we could live with that. That's not too bad. Then we've got some cancer claims: There are thyroid cancer concerns associated with semaglutides, and as a result, the FDA has boxed warnings at the top. So in the case of Ozempic, I'm just going to read you the black box warning straight off the Ozempic.com website. Ozempic may cause serious side effects, including positive thyroid tumors, including cancer. Tell your healthcare provider if you get a lump in your throat, swelling in your neck, hoarse, trouble swallowing, or shortness of breath. Yikes. So Ozempic and the medications that work like it have been shown to cause thyroid tumors in rats. Not in people, because those studies haven't been done. So why don't we know if it causes cancer in people or not? Because there isn't enough research on people, only rodents. So no clinical trials have specifically been done that have been focused on that. There have been shorter trials focused on diabetes, and that's been positive, reducing cardiovascular disease risk, and that's been positive. But no trials have tested semaglutide on actual cancer risk in humans. And this gets me thinking, because I had a professor in medical school who used to recommend waiting 5 years after a drug was released to see the true effects, whether positive or negative, on the population. And I have found that to be good practice, right? Because after a drug is semaglutide released, it needs more time, more research to get all the kinks worked out, and to see if it's going to be a long-term viable option. And why is this important, and why am I talking about it today? Because I don't want you to lose weight and lose your health at the same time. I don't want to see you finally feeling good about yourself, sliding into those skinny jeans, only to find out that you now have thyroid cancer. That's a major bummer. And here's the thing that has me concerned about semaglutide and the unknowns. Thyroid cancer is the fastest growing cancer today amongst women. And at first, the statisticians were considering, are we just detecting more cancer, or is there really more thyroid cancer? And what they found out is there is more of it. And that means that thyroid cancer is on the rise. 1 in every 3 women in menopause will develop some type of thyroid problem. In fact, you may have nodules in your thyroid right now that you're not even aware about. You don't even know. The nodule odds are higher in cases of Hashimoto's thyroid and hypothyroidism. Nodules are basically lumps of tissue that grow in the thyroid that are not normal. And the odds of having a nodule correlate with age. So if you're 40 years old, you have a 40% chance of developing a thyroid nodule. If you have a nodule, the risk of it becoming cancerous is somewhere between 2 to 7%. How do you detect nodules? They can be detected by a physician on a physical exam when someone feels your throat, or through a thyroid ultrasound. It's not invasive, no radiation with it. So here's the bottom line. Anytime we make a decision, we need to be informed. And I want you to be informed for yourself. I don't want you to gain one thing and then lose another. The type of medicine that I practice, natural medicine, is all about making changes and seeing results over time. It's not a quick fix. The best thing, though, about natural medicine is that it doesn't harm your body in the process. I like to say that natural medicine only has side benefits, not side effects. And I know it works. So if you're looking to not harm your body and lose weight for the long-term fix, then natural medicine just might be for you. Because it really all starts with individualized health training. What specifically do you need for your body? Because I believe that where we live in our bodies is like a garden. We don't need to compare ourselves to other, and what kind of flowers are they growing in their garden, right? The grass isn't greener on the other side. The grass is greener where there's more water and more fertilizer and more compost, and where you put your attention, and it's the same in our bodies. So when you go into health training for yourself, you learn what your body needs to function better. And if you're serious about getting results, then it's time to not try it. It's time to train for it. And that's the role of a health mentor. Someone who comes alongside you, guides you, trains you, gives you an education about your health and your body. And then you, in turn, take the education and the training, you adopt new habits, you change your whole self, mind, body, and spirit. It's really such a beautiful thing. I just want to thank you so much for joining me today. If you like this post, you can check me out on the web at www.drandreapurcell.com. If you're riding that roller coaster of menopause, hop on over to my website for a treasure trove of insights, practical solutions, and expert advice to make the transition smoother. And you'll see you can even set up a one-on-one discovery call with me over there. Ciao for now.